Welcome, everyone, to our TEDx adventure on hemangiosarcoma. I'd like to get things going. I'm going to be your host tonight, Dr. Kelly Diehl, and we'll be sharing first a recorded webinar featuring Dr. Antonella Borgatti, and she'll shortly be introducing herself. And afterwards, we'll have a live question and answer period and just a housekeeping rule. Use the Q&A function at the bottom of the screen to send me your questions. And a quick note for everyone who's already submitted questions, I have them. There are some common themes emerging that you'll be happy to know we'll cover both in the webinar and, of course, afterwards in the Q&A section. Also, if you want to use the Q&A function, if you have any technical difficulties, we'll be monitoring it during the webinar, and we'll do our very best to try to fix anything that we can. I think that covers everything. The webinar is about 40 minutes, the recorded session, so we'll get that going, and that'll give us plenty of time to answer questions afterwards. Well, welcome everyone to this latest episode of our TEDxMileHigh adventure, and I'm really pleased to welcome Dr. Antonella Borgatti. Dr. Borgatti is professor of oncology at the University of Minnesota College of Veterinary Medicine. She graduated cum laude from the University of Torino in Italy, and after 3 years in general practice, she received a scholarship to pursue specialized training in oncology at North Carolina State University, where she subsequently remained as a research associate, oncology intern, and clinical instructor in oncology. She then completed a residency in comparative oncology at Purdue University, where she also received a Master of Science degree. Dr. Borgatti is a diplomate of the American College of Veterinary Internal Medicine and a diplomate of the European College of Veterinary Internal Medicine. She joined the faculty at the University of Minnesota in 2008 after 2 years in a busy private practice. Dr. Borgatti is a member of the Masonic Cancer Center and of the Animal Cancer Care and Research Program at the University of Minnesota. And she also serves as the director of the Oncology Residency Program and the director of the Clinical Investigation Center. She has 2 boys, Leonardo and Lorenzo, who are 9 and 7 years old, and a 12-year-old cat named Amelia. So Antonella is a very busy person, and which is even like, it's amazing you could join us. Thank you so much, Antonella.
Oh, it's my pleasure, Kelly. Thank you so much for inviting me. It's a pleasure to be here today.
Great. I always ask people this, is tell us a little bit about your path to becoming a veterinarian and then how you got interested in oncology.
Sure. I decided to become a veterinarian when I was probably 6 years old. I've always loved animals, and I've always had this strong desire to make them feel better. And of course, at the time, my idea of being a veterinarian was very different from what I do today. I discovered that the profession is much more complex than I'd ever imagined. There's so many different learning opportunities. And that's what drove me to oncology during my veterinary school training. I'm from Italy originally, so I went to the University of Torino. And the light bulb sort of went on during a lecture from one of my university professors, who is a surgeon with a strong passion for oncology. And he's a great friend to this day. But that eventually led me to pursue some specialized training in oncology. I came to Raleigh, North Carolina in 1999 with a scholarship from the University of Torino. And so I've been in the United States ever since. I spent some time at Purdue University for my residency and master's. And then I joined the University of Minnesota in 2008. And a big milestone for me was receiving some funding from the NIH, KU1 or Career Development Award, that allowed me to devote most of my time to research. And hemangiosarcoma was really my area of focus of this research. And it's a tumor type that, of course, I'm extremely interested in to this day.
Right. And we're going to dive into that today. And I'm glad to have you here as an expert in that. I think many people tuning in will know something about hemangiosarcoma, but I'm sure there are a lot of folks who have never heard of this type of cancer. So can you tell us a little bit about it, like what it is, like its behavior in dogs? We don't see it much in cats. And so, yeah, if you could just kind of educate us a little bit about the basics of this type of cancer.
Sure. Hemangiosarcoma is a type of cancer that arises from cells that form blood and blood vessels. And it's certainly one of the most aggressive cancers that we see in dogs. It occurs primarily in the spleen. The second most common location is the heart. So we sometimes will see masses associated with the right atrium, one of the chambers of the heart. It can also occur on the skin, the liver. And there are some cases in which it manifests in multiple places simultaneously. And a lot of times, unfortunately, this disease is fatal. More than 50% of dogs that are diagnosed with hemangiosarcoma treated with the standard of care will die within 4 to 6 months from diagnosis, and only about 10% will survive over a year. It's typically treated with surgery to remove the primary tumor and chemotherapy to try to slow down the spread of the cancer or the metastasis. But currently there is no cure for this disease. However, as we continue to research this cancer, we're discovering that there are some different subtypes, and some of them may be associated with better survivals and better outcomes. So I do want to emphasize that there are some dogs diagnosed with hemangiosarcoma that will live a long period of time. And so it's a very complex malignancy, certainly fascinating, and that's why it's one of our research priorities at the Animal Cancer Care and Research Program at the University of Minnesota.
Right. And I know this is putting you a little bit on the spot, Antonella, but I get asked this, which is, do we know any statistics on how many dogs are diagnosed with hemangiosarcoma each year? And is it more common in certain breeds of dogs?
So I would say hemangiosarcoma probably represents about 5% of all cancers that we see in dogs. And so certainly not the most common tumor that we see, but if we translate that 5% into numbers, more than 50,000 companion dogs develop this disease in the United States every year. So certainly not the most common cancers, but certainly because it's so aggressive and so devastating, it's very impactful if we think about more than 50,000 families, being dealing with this disease and with this diagnosis. And regarding the breeds, it was initially described in the late 50s, early 60s, primarily in Europe, as a disease that was very common in German Shepherd dogs that were suddenly dying of some acute bleeding episodes. And then in the late 60s, there were some reports from the United States also describing German Shepherd dogs as a predominant breed. And then more breeds were progressively added to the list of dogs that got hemangiosarcomas. But these breeds also seem to follow some popularity trends. So there's probably a very strong bias in the most popular breeds that present to the hospital and the patients that are eventually diagnosed with this disease. There is certainly some bias in the data that we have due to this influence of breed popularity, because we do see more of certain dogs than others. And also when we look at mutational profiles, molecular traits, the reality is that there are no differences between the various breeds in terms of the way that hemangiosarcoma develops. And it's true that there may be some heritable differences that influence the risk of developing hemangiosarcoma. If we think about golden retrievers, Portuguese water dogs, and some of these other breeds, but this influence is very likely to be pretty small. Also because we don't see hemangiosarcomas very commonly in young dogs. So it's more of a disease of aging and something about just being a dog that is getting older. It's also being reported in other species. It's being reported in wolves kept in captivity, for example, in coyotes and some other species.
Okay, so canids in general. I get asked this, and I don't I hate to put Antonella on the spot as an oncologist, but is hemangiosarcoma, is the incidence on the rise, or are we better at diagnosing it? Do we just
Mhm.
have dogs that live longer, or all of the above, or what's your take on that?
Yeah, no, that is a very good question, and it's probably a little bit of all of the above. You know, veterinary medicine has been evolving alongside with human medicine, and now we have access to improved preventative care, more advanced diagnostics, sophisticated medical treatments for all of our patients. And so, because of this, we have been able to extend the lifespan of our friends, and with longer lifespans also comes an increased risk of developing cancer. So it's estimated that about 50% of dogs that are over the age of 10 will develop some sort of cancer. And hemangiosarcoma, while it's not the most common cancer that we see, as I mentioned before, is certainly one of the most devastating. And so we probably diagnosed hemangiosarcoma now more than we used to decades ago, because the lifespan of the dogs has increased. The other point is that hemangiosarcoma typically requires surgery histopathology for confirmation. So that's how it's usually confirmed. You really need that tissue sample to confirm that diagnosis. And so it's possible that maybe owners now elect to pursue surgery for their dogs or more invasive procedures more than they used to. Rather than, you know, proceeding with something like a euthanasia based on the assumption that their dog may have hemangiosarcoma, which carries a poor prognosis. And so in the older days, you know, that suspicion sort of translated into making a decision to end the life of their pet based on that. And I think to some extent, maybe that occurs still to this day, but I think we're getting better at recognizing that not all hemangiosarcomas are the same. And so that there are some options and there are some things that we can do to help these dogs.
Let's dive a little deeper into that, because you mentioned, and we've been talking about how devastating this cancer is. Talk a little bit about the clinical signs that an owner sees, or how these dogs typically present to their veterinarian.
So hemangiosarcoma, I always say, is a very insidious type of cancer that a lot of times doesn't cause any pain or any discomfort. Sometimes we don't see any obvious clinical signs until a large mass, a large tumor, is either incidentally identified on a physical exam, or what more frequently happens, a tumor mass eventually ruptures, leading to life-threatening complications. So hemangiosarcomas tend to be very vascular, and they tend to produce new blood vessels, and these blood vessels tend to be malformed torches, and so blood tends to pool inside these blood vessels, sometimes preventing nutrients, oxygens from reaching some parts of the tumor, which then dies and causes some leaking of all of the blood from the mass into the cavity in which the tumor is located. And so the manifestations are sort of dependent on the location of the tumor. So for tumors of the spleen, for example, this hemorrhage will occur in the abdomen. And so the majority of these dogs will present to the clinic with signs of sudden anemia, collapse, pale gums, weakness, and eventually on ultrasound we will see that there is some fluid in their abdomen, which is consistent with blood, and so that's a most common manifestation. But for tumors that are in other parts of the body, for example, for tumors of the heart, the bleeding will occur from a mass that is associated with the heart, and so sometimes the bleeding will be within what's called the pericardium, so the membrane that surrounds the heart, and that can cause a lot of compression and a lot of stress on the heart itself, so that can lead to signs of heart failure. Sometimes hemangiosarcoma will affect the bone of dogs. So there are some rare bone tumors that are consistent with hemangiosarcomas. And so in that case, the manifestation is lameness. And that is usually addressed by means of surgery, sometimes amputation of the affected limb. And there are some hemangiosarcomas that affect the skin, and those are more readily identified by the owners because they're not hidden away like those hemangiosarcomas that arise from visceral locations. And so hemangiosarcoma of the skin can be more quickly identified before it becomes invasive, which can happen sometimes too.
You talked a little bit about treatment options before. Can you tell us a little bit more about what treatment options are available for these different types of hemangiosarcoma?
Yeah, first of all, when we think about treatment, we also have to think about what is the goal of the treatment that we provide. And so I would say that with the exception of hemangiosarcoma of the skin, which may be cured by means of surgical excision, certainly in many instances, the principal goal of treatment is not necessarily to achieve a cure, but is to remove a primary tumor, which may be the source of a life-threatening hemorrhage, or also slow down or delay the onset of spread and metastasis. In terms of treatment, certainly surgery is very, very important. So we always encourage, whenever feasible, to pursue surgery to remove any visible tumor mass. Even sometimes when dogs already have presence of metastatic disease, kind of as a palliative approach. And without treatment, most dogs that are diagnosed with the more visceral or advanced forms of hemangiosarcoma may actually die within a couple of weeks, and some others may survive for a longer period of time. And usually the challenge for hemangiosarcoma is the potential spread or the fact that multiple lesions may arise simultaneously in different locations, which is why chemotherapy is also a very important part of the standard of care therapy. And so typically chemotherapy using a drug called doxorubicin or doxorubicin-based chemotherapy protocols is what is typically recommended. And that has been shown to improve the survival of dogs with this disease. There are some situations where surgery can be followed by radiation therapy. That is really dependent upon the location of the tumor. So for hemangiosarcomas that are on the skin or invasive into the muscle or the subcutaneous tissue, certainly radiation therapy can supplement surgery or can be done in place of surgery if we're dealing with a tumor that is non-resectable. In terms of tumors associated with the heart, if the mass cannot be removed, there are certainly some palliative approaches. So for example, as I mentioned before, sometimes these tumors will bleed and they will cause this blood to fill this membrane, the inside of this membrane called the pericardium. So the blood will tend to accumulate between the heart and the pericardium, filling up the pericardium kind of like a balloon. And so there are some procedures that can be done to create a little window on this pericardium so that the blood can flow outside of it and into the chest cavity where it can be reabsorbed. And that alleviates all the stress on the heart and the potential complications from it. The other thing that I should probably mention, since we're talking about treatment, because that's a question that we get a lot, is about any alternative approaches or supplements and things that are gaining a lot of popularity as people try to find a cure for hemangiosarcoma. And so we will have a lot of animals that will come to the clinic already on a lot of these supplements. And we always encourage people to really look at any anecdotal information that they may find on the internet. Really look at that with extreme caution. There are some dogs with hemangiosarcoma that can live much longer than expected, regardless of what we do. And so, potentially anecdotes of dogs living longer because they were on a certain supplements may not be accurate. And so they may give people false hopes that these approaches may be beneficial. And there are some peer-reviewed data now, at least on a couple of these products, that have shown that there is a lack of efficacy. So I think more research really needs to be done to determine whether they are beneficial or not, or detrimental. We have to think about interactions with other forms of therapy or experimental treatments.
And actually, that's leads me to think a little, Antonella, like people obviously come to you with these dogs, and then sometimes they have another dog, right? Or they are worried about their dog getting hemangiosarcoma. I get that a lot. If people have been through this experience, it's pretty drastic and, as you said, really devastating. And they'll go, okay, well, now I have another dog, and like, what do I do? Like, should I be ultrasounding them all the time? Like, what do you tell people who get really worried about their dog developing this type of cancer?
Yeah, that is a very good point, because people will often ask us if they should be doing all of these diagnostics more regularly for their pets, especially if they had another animal who has had that diagnosis. And so they will ask us if they should do things like X-rays, ultrasound, echocardiograms, or CAT scans if they have dogs, especially at high-risk breeds, or those that are perceived to be high-risk breeds. And there are some oncologists who may even recommend performing these tests at a regular intervals of time, every 6 months, or even more frequently in elderly patients. And so I would say that the challenge with hemangiosarcoma is that once the lesions become established, they can progress very, very quickly. And so even if we do these tests regularly, it's possible that we're going to miss it. And so it can present a challenge for early detection. The other thing to think about is if we do identify some lesions or some nodules on some of these tests, we shouldn't automatically assume that these lesions are consistent with hemangiosarcoma. As I mentioned before, this is a cancer that really requires biopsies, histopathology, surgery for confirmation. And so what we need to think about, if we do these tests and we see something that is questionable, what is the next step? So I think they make sense if the identification of these lesions is actually actionable in some ways. So it may lead to some invasive procedures that the dog may or may not need. And but I think the idea of early detection is fascinating and definitely something that we should explore more. There are some tests that are being developed as to all kind of an experimental fashion to try to identify hemangiosarcoma at an early stage. So hopefully we will be able to develop some better methods for non-invasive early detection of this aggressive tumor.
Yeah, that's a good lead in. I wanted to ask you because this will have bearing on your research. What are some of the big things that we don't know about hemangiosarcoma, like the big black box kind of questions that we struggle with?
The reality is that if we think about hemangiosarcoma, actually there is very little that we know about this cancer, but we're learning something about it every day through the research that we do. So, for example, work that some of my colleagues have done at the University of Minnesota, and this is primarily work done by Dr. Dickerson, Dr. Moriano, Dr. Kim, who's now at the University of Minnesota. They've been able to identify at least 3 different subtypes of hemangiosarcoma. So there is an angiogenic subtype, so a very vascular subtype, an inflammatory subtype that has an immune component to it. There is an adipogenic subtype that has a lipid character to it. And this is all based on their gene signatures. But what we don't know is if and how all these different subtypes should be treated differently. And so we know that different tumors or even different subtypes within a certain tumor may respond very differently to chemotherapy. And we have some information now, for example, that indicates that dogs who have the inflammatory subtype of hemangiosarcoma, for example, may have better responses and a longer overall survival compared to other subtypes. And so these subtypes very likely will influence the outcome of our patients. And so we need to continue to explore this to find these correlations. There are also studies that have identified different genetic mutations in these different subtypes, and it's possible that these genetic mutations also correlate with outcome. And so can we identify these signatures that can be responsive to a certain treatment versus another type of treatment? And can we adapt, tailor our therapy to these specific subtypes? So we're recognizing that hemangiosarcoma is not just one disease, it's certainly a complex of diseases, and we're going more and more into the field of precision medicine with our research approach.
Okay, and you talked a little bit about it. Can you tell us a little more about what you guys are doing? Because your group is getting a real reputation as being a center for doing a lot of hemangiosarcoma research. So tell us a little more, because it's really fascinating.
Yeah, there is a lot going on at the University of Minnesota, a lot of interest surrounding this cancer. And one approach that we have taken, thinking about hemangiosarcoma, has been to try to create some more targeted or smarter therapies that are able to target tumor components that are typically not present, or they're present in lower levels in normal tissues, but they are present in higher levels in tumors. And these targeted therapies really didn't exist for hemangiosarcoma for a long time. So for decades, we have been treating this cancer in the same way. And so through our efforts to develop better treatments for hemangiosarcoma, we discovered that these tumors display two proteins on their surface, on the cell surface, and that these proteins can be targets for therapies. And so the two proteins that we are particularly interested in are called the epidermal growth factor receptor, or EGFR. And then there is another one called the urokinase plasminogen activator receptor, or UPAR. And so these two proteins are typically not expressed at the same time in normal cells, but they are expressed at the same time in tumor cells. And one of these receptors, UPAR, is also expressed in the vasculature associated with the tumor, also in the tumor microenvironment. So all of the areas that surround the tumor, where all the construction workers for the tumors are present. And so we developed this drug at the University of Minnesota, and this is work led by Dan Valera at the Cancer Center. He developed this drug called EBAT, which stands for epidermal growth factor bispecific angiotoxin. And essentially, this is a drug that is able to anchor these two receptors and deliver toxin to the tumor. So the toxin was, of course, genetically modified to try to avoid any reactions from the patients, any allergic reactions from the patients. And so, but it's a drug that doesn't block these receptors, but really uses them as hooks to deliver the toxin to the tumor. And because EBAT appears to have this activity not just on the tumor, but also the surrounding microenvironment, what we are very interested in doing now is also look at EBAT in the context not just of treating hemangiosarcoma, but also in trying to prevent hemangiosarcoma. And so this is something that we are exploring now in another study that we're doing currently, which is called the Shine On Continuation clinical trial, where we have developed a test. This was developed by Dr. Modiano in his laboratory. And it's a test for early detection of hemangiosarcoma, where dogs are screened with a blood test that looks for evidence of cancer-associated cells within the blood. And so based on the results of this test, these dogs can be assigned to a certain risk category. So there are dogs that may be assigned to a high risk of developing cancer during the course of their lifetime, and other dogs that are assigned to a low risk category for developing cancer. And so dogs who have had multiple tests that showed that they are at high risk of developing cancer, they're eligible to receive EBAT prevention. So they can receive this drug, and the hope is that EBAT will be able to suppress cancer formation in these dogs. And so we will continue to monitor them over time for their lifetime to see how to answer this big question that we have by conducting the study. But in the context of treatment, EBAT is certainly, we have shown with several clinical trials that we have completed that it's a safe drug to give, and that it may have some activity against hemangiosarcoma, but we need to do a lot more work to try to optimize its application in the context of treatment and prevention.
Yeah, it's really exciting. If people are listening, because they're going to want to maybe think about, can I participate in this? Or you discussed your early diagnostic tests. Are those available commercially yet? Or can they work through their veterinarian, or can they contact you? Where are you at with that?
Yeah, that's a good question. The test is still under development, and we are exploring a lot. We have a lot of questions still that we need to answer in the context of our clinical trials. And so we are exploring this test exclusively in the context of the Shine On studies that we're doing, and we have completed enrollment. So we are in a follow-up phase. So the participation currently is limited just to the dogs that have enrolled already. And so maybe things will change in the future, but for now we want to complete the follow-up of all of these dogs. And then the idea is that hopefully we will certainly make the data available to the community, publish the results, and then we'll see if we can continue to develop this test to the point that we can make it available to everyone.
Right. Well, and you saw my cat photobomb this. So a really quick question. Do we ever see hemangiosarcoma in cats or not, or what?
Yes. So hemangiosarcoma is certainly not a tumor unique to dogs. As I mentioned, it has been reported in wolves, has been reported in coyotes, and certainly cats can get hemangiosarcoma too, and it's certainly a rare malignancy. And we also see an analogous cancer in people, and it's referred to angiosarcoma. So also a very rare cancer that affects about 300 people every year in the United States. Has a lot of similarities with hemangiosarcoma, and also some differences that we're now identifying with looking at molecular signatures and mutational profiles. So not exclusive for dogs.
I know, Antonella, you probably talked to a lot of people about hemangiosarcoma. What are some of the most common misperceptions you hear from both dog owners and even veterinarians that may contact you for help?
Yes, so that's an excellent question, and there are definitely some misconceptions, and I would say that probably the biggest misperception is where does hemangiosarcoma start? So for a long time, hemangiosarcoma was assumed to be a cancer that arises from endothelial cells, so those cells that line the blood vessels. And but we went back and looked at the cells of origin, and we really don't think that it is endothelial cells as it was once assumed or thought. So we think that actually this is specialized cells that live in the bone marrow or other organs that form blood cells and blood. So a group of cells that are called nerve cells that really support the generation of blood and all of the blood constituents. So we think that this is probably the cells of origin, and that different subtypes of these cells are what give origin to the different subtypes of hemangiosarcoma. So the truth is that nobody really knows for certain, but if we follow the data, and this is mostly work that has been done by Dr. Kim, Dr. Modiano, really the most likely place of origin is the blood forming organs. And then these cells will find some capillary networks, and they will localize in different organs within the body, and they may remain in those areas in a pre-malignant state. until a critical event takes place that triggers the proliferation of these cells, leading to the formation of bigger tumors, which then can lead to clinical signs. So very fascinating research that was done by my colleagues. But yes, I would say that that's probably the most common misperception. And probably another misperception is that, that again, all dogs with hemangiosarcoma will die within a short period of time. While it's true that the majority will have a poor outcome, there are also these dogs that will live a long time. And so we have to remember that as we approach these patients in the clinic.
Right. And this whole idea of where this tumor arises from, for folks who may be listening and going, geez, I didn't know that, it's recent. Like, we even at the foundation, we have to go through some of our old, and they're not even that old, like blogs and a lot of stuff, and start revising because we have this new data that really is changing our perceptions. And I know sometimes it's hard, and Antonella can speak to this as an oncologist, is for us to grasp mortality data in animals because we have the option of euthanasia and we have the issues of finances.
Yeah.
So it's sometimes, right, it can be hard we say, well, this is their average survival time. But for many people being faced with a big, giant veterinary bill and a bleeding mass, it skews our data. And Antonella, can you talk very quickly to folks about like how euthanasia can sometimes affect data for oncologists?
Sure. Yes, that is an excellent point, Kelly, and I'm glad that you brought it up because, for tumors like hemangiosarcoma, but that applies to other malignancies. Certainly, early euthanasia may provide this information that is then available to the wider community that the survival is really, really short. It also prevents us from really exploring to a deep level how treatments can change or can impact outcome. And so if a decision is made to end the life of an animal, which may be very appropriate in some situations, but sometimes it may be a little premature, but that certainly creates an obstacle for us because we don't have enough information to really help other owners in the future to make an informed decision. Or, certainly I would say that a lot of the information that is available in the veterinary field, unfortunately, is mostly anecdotal because the numbers in a lot of the studies that have been published or that are being published are much smaller compared to what we see in human medicine. And sometimes it's hard to extrapolate even more from these smaller studies the information that may be applicable to a certain pet or a certain patients and family and help them make a decision.
Right. I think it's tough. As an internist, I face, I don't have some of these problems. If I have a dog with diabetes, a lot of people are like, okay, sure, I'll treat that. And so we have these data on diabetes or chronic kidney disease in cats and hyperthyroidism because they're different. They have a different emotional reaction. I think people have a real strong reaction when they find out their dog has cancer. And as a person who's had a dog and a cat, two cats in my lifetime that had cancer, it's very it's a charged word. And I think it's tough. So as we wrap up, what is your take-home message for people when it comes to hemangiosarcoma in dogs?
Yeah, there are several things that I guess are take-home messages that I would like to emphasize. First of all, as I mentioned before, hemangiosarcoma is more of a complex of diseases and not just one disease. And so the more we learn about all the differences between these subtypes and the more knowledge we generate, then hopefully with time we will be able to develop some therapeutic strategies that are more targeted to the individual patient, and hopefully they'll be more effective for those patients. And the other take-home message is that, again, hemangiosarcoma doesn't have to be a death sentence. We are learning more about this disease. We have learned probably more about this disease in the last 10 years, 5 or 10 years. And so going back to what we were talking about, you know, just the assumption of hemangiosarcoma shouldn't necessarily translate into euthanasia. And again, there are always exceptions and situations where owners just are kind of forced into that decision because they, you know, all of these treatments are very expensive. Surgery is very expensive, transfusions, and all sort of things. But the decision shouldn't be driven exclusively based on a presumptive diagnosis and the presumptive outcome. And the other thing, you know, we mentioned breeds, and so also being a little bit careful about the breed profiling, and because there are a lot of things that really need to happen for hemangiosarcoma to develop in a patient, and breed is not the only factor that contributes to that.
Right. And I think that's easy because we do see it in certain breeds. There's no question. So you're going to pick up any article on hemangiosarcoma, including stuff we've written about that. So this was really, really helpful, Antonella, to kind of let us know about this. And I appreciate you joining us for this portion of our TEDx adventure. So thanks a bunch, Antonella.
Yeah, thank you. My pleasure.
Hi, everyone. I hope you're seeing me. I have had some great questions coming at us that in a minute I'm going to ask Antonella to pipe in on a few of these, but I did want to comment, and I commented to several of you as fast as I can type, and I'm going to put in a commercial for the Golden Retriever Lifetime study because I think it will help answer many of your questions. A lot of folks asked about what are triggers? What maybe can I do to prevent disease? What's the role of diet, right, in the development of this disease? People talked about drugs, vaccines, genetics. And I want to put in a commercial for our hemangiosarcoma initiative at Morris Animal Foundation. So this is something we launched not that long ago, and we're fundraising very vigorously around hemangiosarcoma. And our goal is a multi-year, multi-million-dollar funding initiative to try to put some resources financially toward the study of hemangiosarcoma a little bit more in depth, as well as we are really encouraging people to access our Golden Retriever Lifetime study samples. Some of you I know are in the study. Some of you may have heard of this study. This is where we are following 3,000 Golden Retrievers through their lifetime. And in particular, it is a cancer risk factor study at its very heart. We collect not only biological samples, but just tons of data on these patients. We look at their housing situation, the food they eat, what preventive medications are they on? Are they vaccinated? Are they not vaccinated? Are they spayed and neutered? And when did that happen? Several of you asked about hormone dose and the development of cancer. We were really interested in that. Because we're getting to start, we started in 2012, so a lot of our dogs, as you can imagine, are aged. Hemangiosarcoma is turning out to be the #1 cause of cancer deaths in our cohort, and we were surprised about that. It's double the amount of cases of lymphoma that we're seeing. And because of this, we launched our hemangiosarcoma initiative. We just had our first call for proposals, and Antonella was in that batch of proposals coming to us to ask for additional funding and hopefully access to our samples, because we have dogs that developed hemangiosarcoma and we were collecting blood samples, for example, for years before they were diagnosed. And many of you mentioned to me liquid biopsy, right? What are blood tests? Because our conventional blood testing really falls short in diagnosing these guys, but are there tests we can run that will pick these guys up much earlier? And we're interested in people. We've had over 30 proposals submitted to us. We're hopeful that many of them will be accepted for funding to look at exactly what you guys are asking, so that maybe we can finally get some answers around these questions that everybody asks me every time I talk about hemangiosarcoma. I'm sure Antonella gets the same type of questions. So I hope that answers some of you guys what you have been asking me. I am going to now ask a few questions of Antonella. And so hi, Antonella. Welcome.
Hi. Hi.
Thanks for joining us again. And I'm looking through some of these to try to ask you, I guess, what's your thoughts on the liquid biopsy tests that are out there? A whole bunch of people are asking about those screening tests that are now commercially available. Can you talk a little bit about that?
Yes, and thank you for the question. And that's a very popular question right now because there are so many tests that are being developed and there's a lot of research surrounding them. So we have had multiple conversations with a lot of people and other investigators that are involved with the development of these tests. Some of them are based on the identification of cell-free DNA, other tests, and I saw some of the questions that were submitted during the webinar were around surrounding nucleosomes and other methods of detection. And so these are certainly promising tests in many ways, but from my perspective, certainly would benefit from further development. And so we have partnered with some of the companies that are developing these tests to try to incorporate them in some of the research that we do to continue to accumulate data and gather additional information to determine how to best to utilize them in what context. And also the other thing that we have challenged a lot of these companies to think about is what is the actionable step once the results become available? You know, that's something that we talk about all the time. In a patient where a test indicates the possibility of the presence of cancer, that can create a lot of emotions and a lot of fear in the owners. And so there has to be a pretty solid plan about how to approach these situations in terms of staging modalities, which may or may not show obvious cancer. And so if they don't, you know, then the next question is, what is the monitoring plan? What are we going to do to continue to monitor this patient who may have cancer somewhere that we can't identify? And how do we treat it? Or do we treat it? So there are lots of questions within a question.
And I'll jump in here too. I forgot to mention, a lot of people asked about the genetics of this disease. Antonella spoke a bit about, you know, there have been some genetic markers, right? And as our technology has improved, I think we are looking more precisely at looking at the genetics. And that's another thing we're doing with the Golden Retriever Lifetime Study. Dogs, we have them all genotyped, and we're again asking people, please come and get our DNA and take a look at it. But what I want to ask Antonella, because this is work that Morris has funded but has been done at University of Minnesota, is do you want to comment a little bit? Somebody asked about propranolol and beta blockers. Do you want to comment a little bit about that research?
Yeah, I can certainly comment a little bit about that because it's a very exciting project that we are doing. Dr. Erin Dickerson sort of spearhead the whole project and the repurposing of propranolol for use in patients with hemangiosarcoma. And so propranolol is a commonly utilized drug, as we all know. So it hasn't been utilized specifically for cancer treatment for many years. But we have started to recognize that propranolol, at least from the human experience, is a drug that has shown some efficacy for the treatment of tumors that are common in infants and children, these hemangiomas that should spontaneously regress, but sometimes they don't. And so propranolol has been utilized to facilitate and promote the regression of these lesions. And so the observation of efficacy in that particular context then led to utilizing this drug for the treatment of angiosarcoma, so a malignant tumor that highly resembles hemangiosarcoma, with favorable data being published, looking at the efficacy of propranolol by itself and in combination with chemotherapy. And so we started to explore that and potentially apply it to potentially apply it to the canine population. And so we currently have a study open. It's called ProDocs. There's some information on our website. And the ProDocs study enrolls dogs that have splenic hemangiosarcoma. They have no obvious evidence of metastatic disease, and they receive propranolol at a higher dose than the commonly utilized dose of propranolol. So we propose an escalation where the dose is increased every few days until then chemotherapy is introduced. And the treatment is sort of done in conjunction with what's considered standard of care. So surgery, splenectomy, specifically in this case, and doxorubicin chemotherapy. And so we're still collecting information. I think we're almost done with enrollment. We have one more spot for one more dog at the University of Minnesota. If anyone is interested, feel free to contact us. We're also working with the Ohio State and with Penn University and Purdue University on this project. And so it's a collaborative effort.
That's great. And I don't know if you can answer this one, Antonella, but a lot of people asked about the EGRF, HER2 vaccine. What do you know about it? Because I don't know a ton of how things are going with that.
Yes, so that's also a question that we get quite a bit from owners who come in with their pet being diagnosed with hemangiosarcoma, but also in cases of other tumors. And that is, I think you're referring to the Yale vaccine. And so that is, there was a lot of information on their website. And then the last time I checked, I couldn't really access the website. So I don't know if some of the information has been taken out or if it's being updated. What I know is that it has been communicated that more than 200 dogs have been enrolled in the study and they received the Yale vaccine. But to be honest, very little to no data has been shared with the oncology community. And so it is really difficult to make a recommendation to pursue a vaccine that we really don't have access to the actual data that was collected and published information. And so it's something that we're not currently recommending when we see owners and they ask us for this particular option. There was some mentioning on their consent form about the possibility of abscess formation at the site of the vaccine. There's also a comment in the consent form that the abscess should not be painful for the dog. But most abscesses are painful. And so just some questions that we had also about the consent form for that particular study that would probably need to be addressed before we could recommend anything like this for our patients.
Okay, that's really helpful to know because a couple people asked about that. I did have a couple people. I'm going to answer one question, then I'm going to make Antonella answer another one. So a bunch of people asked about carcinogens and water and environment, and I'm going to talk about a little bit about that's something that in our Golden Retriever Lifetime Study, right, we have been actually capturing very carefully. So we ask questions like carpet. Is it natural fiber? I mean, really, really detailed questions. What's your cooking fuel in your primary residence? What type of water are you using? And that data is available to people for analysis, and they can use just the data, but we can also provide them with samples. So again, in answer to you guys, we don't know a lot, right? We have some information about exposures, I think in lymphoma, right? Antonella probably the most, but we really don't know about hemangiosarcoma. So we're hopefully going to get there. The question I have for Antonella, because I got it both submitted ahead of time, somebody commented on it, and here is people are like, why not just take out the spleen? So can you address why that may be or may not be a good preventive for this cancer?
Sure. And that's also an excellent question, and also one that we get asked in the clinic. So the short answer is that we do not advocate for removal of the spleen in situations where We either are concerned about hemangiosarcoma formation in a breed that is considered to be at risk, or in a situation where there is potentially the presence of hemangiosarcoma, unless, not prophylactically, at least, of course, once a mass forms, and that is typically the recommendation, but prophylactically, we don't recommend that because of the nature of the disease, from a little bit of what I described before, and how the tumor originates and forms. We think that a lot of the cells that will eventually lead to hemangiosarcoma development tend to localize in multiple organs, sort of at the same time, originating from the bone marrow. That's a theory that we are going for based on the data that has been generated by a lot of my colleagues. And so by being in multiple places at the same time, there's a concern that even by removing one organ, the disease, if the disease is destined to develop, it will probably develop somewhere else. And so that doesn't necessarily solve or prevent cancer, because, if it doesn't form in the spleen, it could form in the liver, the heart, or in another part of the body. And so we are still faced with having to come up with an additional treatment plan.
That's really helpful. Another common question that a lot of people are asking, Antonella, and you touched on this in the webinar itself, but I think there's a lot of questions surrounding supplements, right? Like I'm going to Turkey Tail, I'm going to Union Bio, which I always say wrong. Like, I know I've seen some studies about those that are controlled and some anecdotal. Where is that research? And do you know anyone who's even looking at that anymore?
I don't know that anyone is looking at that specifically right now, although it's very possible that there is some research currently being conducted. There have been at least a couple of publications that have shown a lack of efficacy for a couple of these products, Yunnan Baoyao and Immunity. And when we get questions about those supplements, or when we see people who are giving these supplements, to their animals, we completely understand why, they're doing that. We want to help our animals. We want to try to give them the best chance that they can get. At the same time, because of the lack of efficacy that has been demonstrated, and also the assumption that these supplements are harmless, right? A lot of times we hear, well, it may not do anything, but it's probably not going to hurt. Well, we don't know that, right? It's possible that they may actually interfere with some of the other treatments that we give. We don't fully know drug interactions. And so that assumption may not always be correct. And so not only we generally don't recommend these products, but we actually strongly discourage their use, especially for dogs that will be enrolled in clinical trials where we're working with investigational treatments and new drugs. And all of these potential interactions are unknown. Since we were talking about the propranolol earlier, there is actually evidence in the human literature that the combination of propranolol with some of these supplements can actually lead to fatal outcomes. And so that is something that I'm always happy to point out because it's an important issue that we have to kind of face in the clinic every day.
Okay, and we're almost at time, but a couple of people asked about Bartonella, which is a bacterium that's in the blood and has, I know there's been some work on looking at that and hemangiosarcoma. So can you talk about that, Antonella?
Yeah, so I know that there was some published information on the potential association with Bartonella and hemangiosarcoma development. So it's not my specific area of expertise, and I haven't conducted this type of research to really confirm or dispute, but I know that work that has been done by some of my colleagues to try to reproduce those results haven't necessarily confirmed that association. And so I would have to say that I can't really speak too much on that in definitive terms. Just because it hasn't been reproducible from what I know.
Yeah, I think that was my impression too, Antonella, but I'm
Yeah.
not quite on top of the literature as you are. I know that here's some insider baseball for everybody. I know that we are talking with some researchers, and I don't know if we're still going to do it, but as in the context of sending golden retriever lifetime study samples. But so far, and we'll see what happens, but Bartonella is a kind of squirrely organism. It's not always very easy to diagnose. And sometimes you get a positive titer and you're like, well, what does that mean? Does that mean they're exposed? And I can tell you that we don't have a lot of dogs in the study that are positive for Bartonella. However, that doesn't mean the organism may not be there because it is a kind of squirrely organism. But it would be interesting to see if that would be maybe a potential trigger for this disease, though my inclination, and Antonella can correct me if I'm wrong, is that there may be different kinds of triggers, right? There may be multiple triggers. And if you happen to live in the Northeast and you have this genetic profile and you come in contact with something that might trigger you, but the same trigger in a different genetic profile might not trigger the disease. And these are all things we're trying to sort out because we see lots of different dogs, lots of different backgrounds. We have dogs all over the world that get hemangiosarcoma. We know that. And it's a complicated problem that we hope we can sift out. And that is all the time that we have. So everybody can go. If you're here in Denver, we're all very excited because, of course, we have the NBA finals. And so you have some time to go take a peek at that. And I want to thank again Dr. Antonella Borgatti for joining us, for being just a great companion to Morris Animal Foundation. I've asked her to do a bunch of different webinars, and she's a star on television now. If you ever watch Lucky Dog, because we did that together. And I really appreciate everyone who attended. You guys had great questions. I'm so sorry that we didn't get to all of them. And I'm sorry that sometimes I just said, hey, wait for the golden retriever lifetime study results. But I think that's going to be important. Contribute to Morris Animal Foundation and our hemangiosarcoma initiative, because that's going 100% to hemangiosarcoma research and to folks like Dr. Borgatti and the folks at University of Minnesota that are doing such great work. So again, thanks to everyone for joining us. The recording will be available. We'll send links to people, and stay tuned. Hopefully we'll be back in a couple of years with some answers, right, Antonella?
I hope so. Yeah, I think so. We'll definitely come up with something in the next couple of years. I'm very optimistic.
I am too. So
Thank you very
thank you.
much
Thanks,
for inviting
everyone.
me.